Hey there. In this interview, we had a really great opportunity to talk to such a dynamic leader in our area, Miss Ann Awalt. She's the CEO and director and kind of champion for the Community Action Corporation of South Texas. And we get to talk to her about something really special, which is the evolution of how a nonprofit like KCOST manages to meet the behavioral health needs of rural communities across 16 counties. Which just, I mean, you'll hear it as her and I are talking, it just constantly blows my mind. And I think the theme that emerges is they keep having to evolve and keep having to understand exactly what their role is. And they sort of accept this pivot that they have to have a holistic footprint within these communities if they're going to make a difference in mental health. So I hope you enjoyed this wonderful interview with Miss Ann Awalt. How long have you been attached to KCOST?
So I started at Community Action in 1975, about a month after I graduated from college.
Yeah, wow.
So I got my BA and
First job out of college.
First job out of college. Got my BA, moved back to Alice, and heard about this organization that at that point was starting out. The corporation was incorporated originally in 1971. So when you're young, your perception of time is really different. So I thought, wow, that's a very established corporation. This sounds like that'd be a good job. Little did I know it had only been around like 4 years, and that of course all the federal funding at that point was on the chopping block. So this was not exactly a career move that screamed longevity.
Yeah.
So I started working in the Head Start program and was the nutrition coordinator and did that for a while. I was actually doing menus for the Head Start program and did a little monitoring and also started working with parents. So I did a lot of parent involvement activities. That to me was pretty important to me.
When I think about footprint, when I think about expansion and scope of impact, y'all are at the top of the list. You went from 3 counties to 14 counties. Right?
I think we've got about 17 counties now.
17 counties.
We had less than $1 million when I started. We had about $250,000, and we had maybe 75 employees. We've got close to 700 employees now. The challenge was not so much the growth, because as I tell people, the money is out there, the vehicle to do the growth is out there. The challenge is how to do the growth in a way that you're true to your mission. You're not just grabbing low-hanging fruit to grow for the purpose of growth. And the other, I think, advice I would give folks is make sure the infrastructure is there before you grow.
Yeah. And so y'all went from very basic, electricity and food, meeting these types of needs, all the way to now. Y'all are not just in these 17 counties, but the range of programming, it just blows my mind, right? Like y'all have health clinics, y'all have mental health counseling, y'all have teen pregnancy prevention programs, y'all have Head Start programming. You have senior centers. Like it really is something that seems like it is across the lifespan and across the range of needs across the lifespan. Like really feathers out.
I think when you're in rural areas, urban areas can look to foundations to support them. And urban areas have a variety of agencies that provide all these services. Rural areas don't have that. So I think we actually became the service provider for all these services because nobody else was in our area that was doing that.
And so can you talk to me a little bit about your thinking of meeting just the disparity of resources in sort of the 17 counties that y'all cover?
The biggest difficulty I think we encounter is attempting to attract folks to deliver those services. So what we try to do in these communities is kind of figure out what's not there and then figure out how we can get those services in that county, in that city, or in that school district, either through partnerships, or if that's not available, we'll do it solo if we can.
Mhm.
So there's two things that I'm worried about for the future. I happen to think that child health is, someone asked me the other day what I thought was the most overriding issue in the area, the thing that drives things, and I believe it is child health and well-being.
Mhm.
I believe we're paying the price now for not taking care of child health and well-being 20 years ago, and I think that's a price we're paying now.
Yeah.
What concerns me greatly is, and because I've been looking at some data, and the number of children participating in Medicaid and in CHIP have fallen off in the past couple of years.
Mhm.
So there's some data out that suggests that we have a huge number of children in Texas, almost 2 million children in Texas, that at least one parent in their family is not a U.S. citizen.
Mhm.
Well, that means that somewhere around 24-25% of every child in Texas has one parent who's not a U.S. citizen.
Mhm.
So when you do a policy like the public charge policy, where if you've participated in food stamps or you've received public housing authority assistance, it will count against you
Mhm.
when you're trying to work towards citizenship.
Mhm.
There's literature out now that suggests that those kind of policies really work against folks participating in programs that are safety net programs.
Yeah.
So I'm worried about that for the future.
Yeah.
The other thing that concerns me for the future is climate change.
Mhm.
I'm really worried about that. And I'm worried about that because we all saw what Hurricane Harvey did to our service area.
Yeah.
And if storms of that magnitude become the new normal,
Mhm.
then the way that we deliver service and what we deliver as a service is gonna be vastly different than what it is now.
Yeah.
Right now, we're worried about helping people through the summer to make sure that they can pay their utility bills. We wanna make sure seniors don't have to choose between utilities and medication.
Mhm.
But if that's gonna be the new normal, then our charge is somewhat larger than the charge that we have now. So those are the two things that I am very concerned about for the future.
Yeah. Thank you so much for bringing those two positions forward. There's something that with me personally I really resonate to. If we're gonna have a fighting chance for well-feeling, acting, and believing communities, that really we gotta get them started very young, right? And I think there's a lot of data out there, especially from groups like Castle and stuff like that we can start taking care of these things very early and in a couple of simple ways, and they'll make impacts that just magnify over the course of someone's life. But on the other hand, we have if we are able to develop this inner resilience and this core of self, there has to be a system that those traits can be activated within. Like it doesn't do us, in my opinion, much good to develop them early on if they can't be activated within an environment and a system. And so I think as you're talking, one of the things that emerges to me is y'all still have a foot in the 70s. You still have a foot in that identity of we're taking care of making sure people can pay their electric bill. We're taking care of making sure people are enrolled in the benefits that they're eligible for that may not count against them if they're going for things like citizenship or other types of opportunities. But you also have an eye to the future, right? Where you're looking at how can we organize our systems of service and our systems of care in a way that facilitate not just response to disasters or tragedies, but in a way that facilitates response to the basic medical and mental health needs of community members.
Well, I think if you've been in this business for a period of time, or if you're new to this business,
Mm-hmm.
but you're very committed to it, it's kind of easy to see why that has to happen, because you're not just talking about delivering a service.
Mm-hmm.
The delivery of the service is what we do, but the building of the community is really what that's all about.
Mm-hmm.
if we were just delivering a service, we'd be an electric company. You know, we don't,
Yeah.
we don't wanna do that,
Yeah.
you know. What we're in the business of doing, and I think our mission speaks to this. So we graduated our first group of parents. We started a new evidence-based parenting class.
Mhm.
And we piloted it first in Kingsville, worked well, we worked out the kinks, and the second group we graduated was Falfurrias.
Oh, yeah.
And that was like phenomenal.
Yeah.
The superintendent, let us use their big multi-purpose auditorium,
Mhm.
and the parents showed up, caps and gowns, there was a
Oh, my
nice
gosh.
dinner,
Wow.
we took pictures. It was just it was a fabulous event.
Yeah.
Their families came to watch them graduate. We had a graduation ceremony, and it was wonderful to listen to the parents that went through this, because previously they lived in this small town of 7,000.
Mhm.
They'd known each other, because, you know, if it's a town that small, you're gonna know who you are.
Mhm.
But they'd never really talked about what it meant to live in that community, what challenges they were facing as parents raising children, what solutions and resources were out there to help them. And as a consequence of this, they became a really strong group.
Mhm.
I ran into one of them the other day. I was in Falfurrias, and ran into one of the parents, and she was telling me that they still get together.
Wow.
So those are the kind of things that when you walk away from, you know they know how to budget, because we did budgeting classes.
Mhm.
But it's more than just knowing how to budget, you know, it's knowing how to build those communities and to build those relationships.
You know, a lot of times I think when people like figuratively look at the way that programs like K-COS or groups like K-COS work, is they have these needs that they're trying to meet, whether they be housing or they be, you know, support for this, or, you know, educational activities. And then they think that there's this direct link between that and some sort of outcome like better health, you know, better mental health, something like that. But really there's something in between that, which I think that y'all do, that I just honestly admire it so much, and I'm just in awe of how y'all manage to do it. But it's sort of exactly what you're talking about. Y'all are able to build these resilience characteristics in people through the direct programming. You're able to build hope by facilitating things like these ceremonies where their families come and like witness this development, witness this thing. And, you know, and sometimes you're in communities like this where these folks, they may not have completed high school, or they may have completed their GED. It's the first time they put on a cap and gown.
Mhm.
Their partners are there, their families are there, their kids are there witnessing this, and it can be hope instilling. And then there's this third piece where through all this, y'all are building social capital.
Mhm.
Y'all are building this vibe among people who live in these tiny counties or these, you know, larger counties, where they don't have to just come together when there's a crisis.
Mhm.
They can come together for coffee.
But the important thing I think about that, or the thing that backs that up, is the staff has to have that.
Mhm.
We can't give it to people if we don't have it among ourselves.
Mhm.
So we can't go out and tell people, you know, be strong, be together, support each other, have goals.
Mhm.
If this 700 people, if the group, if this corporate group
Yeah.
doesn't have that in ourselves. So we have to develop, I think it's incumbent on leadership in this agency to make sure not just that we're running what we need to run according to regulations and guidelines, and we're having the outcomes that we need to have for our funders, but it's important the way that we do it. It's not just that we do it, but it's the way that we do it.
Mhm.
So you know, the staff has to have some resilience. The staff has to be hopeful.
Yeah.
You know, so that, you know, I give a lot of credit to the agency's leadership. I think we've got a fabulous group of staff, and I give a lot of credit to our board of directors.
Mhm.
We've got a great board of directors. I will be 7 years.
Mhm.
The board has had a quorum every month for the last 7 years for board meetings.
Well, because y'all do have to meet once a month, right?
We
Like
have-
other people get by with like the twice annual or the quarterly meeting, like
We have to meet monthly, and we've got folks driving an hour and a half
Yeah.
in to meet.
even during holidays.
Even during holiday months, we have to meet, even during the holiday months. So, if we don't have it as a group, we can't inspire that in the communities that we work in.
Yeah. You've talked about all these groups that you're with. You've talked about working with schools. You've talked about partnering with, medical providers and things like this. But you also said that one of the challenges that rural agencies meet is that they don't necessarily have the resources that maybe some of the larger urban groups may have. And I'm curious what y'all do see as your resources that you tend to rely on. One of these seems like human capital, right? Like you've got all this human capital. To this point, like we were driving out here, and I was telling Julia, I was like, "You're gonna meet someone named April, who just to me probably wears a cape when she's not on the she deserves one, or everybody here, their paycheck should probably come with a medal or something. Like they're just so meritorious at what they do. Y'all have this amazing human capital. I'm curious what other resources that you see going on for y'all.
I think one thing that when I talk with folks about coming in to work here, one thing I talk to them about is the incredible amount of responsibility that every position has, because every position has an incredible amount of latitude.
Mm-hmm.
We can do anything or be anything that we want to be. So if there's a project that someone wants to pursue and it meets the need and it lines up with our mission, we will put the resources of this organization behind it to attract whatever money we need to attract or whatever funders we need to attract to make this thing a reality.
Yeah.
And in very few organizations do you have that.
Flexibility.
That flexibility. Now we can't, we're trying to recruit doctors right now, and we're having a heck of a time.
Well, I feel like that's
with it.
everybody. Like everybody's trying to recruit all the doctors right now.
Everyone's decided they need to live in Houston, or they need to live in Dallas, or some people, San Antonio is good for them. So I'm not really sure what we have a couple of things that we can use to try to get folks into the area, and one is the loan repayment program, because the loan repayment program is a large perk for these folks.
Yeah.
We try to set up benefits, fringe benefits for the agency and the folks that work here to try to attract them in. We have a fairly good benefit package that comes with a lot of PTO. So people have a lot of personal time that they can take off. The agency respects families and supports families. So things that folks would normally have to take off work for, people are able to do that here. So we try to make this place as friendly and as inviting as we possibly can.
Yeah. So it sounds like on one hand you've got this flexibility and responsiveness to help your folks pursue their passion pitches, right? Like someone has this heartfelt passion pitch and they're going to pursue that, right? And I think that can be so important. And then you've got incentivizing programs to bring in talent, things like that. I'm curious, what are some, because this whole grant is about integrated and team-based care. For you, you mentioned your board and some things like this, but you've also mentioned schools. I'm curious how important you think schools are, school districts, to be able to, get towards the levels of success that you're hoping to have.
When we started collaborating with the school districts for Head Start, the hardest hurdle, the first hurdle was language, because district folks speak an entirely different language than community action agency folks. So the first couple of districts we were in, it took a period of time so that we could understand exactly what we were talking about. And the second hurdle we had to overcome was respect.
Yeah.
I'm not sure that the district folks appreciated, our knowledge, experience, background, credentials. I'm not sure our folks appreciated the district's knowledge, background, experience, credentials. So it took a while before we, with the first couple of districts, reached that level of mutual respect and understanding. Once we were able to do that, then anything else, any other barrier in the way, we can work through.
Yeah.
So
It's almost like y'all came to this as too strongly identified, we've got our own thing, but in a way, it almost sounds like your missions, you had to find the overlap in the missions.
I credit our Head Start director, Elena Esquivel, with this. And Miss Esquivel started out as a teacher in a Head Start classroom, had a high school degree. At that point, Head Start teachers didn't need to have bachelor degrees when she started. So she's been with the agency, I think 1 year longer than I've been with the agency. But she worked her way up, went to school at A&M Kingsville, and got her bachelor's degree in early childhood, and has done an amazing job of assembling a staff that we have probably 10 people with master's degrees. We've got one young woman who's finishing up her PhD. So she's done a really good job of making sure that we've got the credentials to back up what we're doing with children in early childhood.
And that just blows my mind that y'all would need credentials. I feel like y'all have all the street cred you need. Like degrees give you an amount of knowledge that is just a knowledge and experience and exposure to certain things that you just can't get other places. However, you can't get everything in those places, and y'all's like street cred. I mean, y'all have a PhD in how to do it. You know.
In the work we're in, you have to have both.
Yeah.
And I think that's one reason why we've been successful. When our folks want to go back and get their masters, this is something that the agency, if we've got the funds, will pay for. And if we don't have the funds, we certainly give people time off to do that, because it's very important that we have not only the street sense, but that we've got the credentials and degrees to back us up.
Yeah, it's really neat to hear. So maybe we can go back to this idea, because I think that this idea is probably really close to the mission of our grant is, you mentioned that there were two things looking forward that you think about: the health and well-being of our youth, and then it was like the systems or global warming, but really that distilled down to this idea of the systems and structures being in place for responsiveness. And one of the things that we talk to our students about, and we talk to the trainees to this program about, is those system and structures, especially when you're in rural communities, tend to be spread very thin. And instead of having one client go to separate appointments, or one provider go to separate clinics, if we can bring them all under one roof, we might be able to meet the broader need in a more efficient way. And that seems to be something that y'all really are able to pull off in the communities that I visited, where y'all have a footprint.
We still have a ways to go to get to where we need to be. So there are some bureaucratic things that are preventing us from doing this, but we need to get smarter and work around it. What I see is somebody comes in and they fill out one application, and that application enrolls them in everything that our agency does.
Yeah, so just one, right, instead of like 12 applications or sub-applications, you fill out one app and it processes you through all your opportunities.
Exactly. And we've spoken actually with some folks at some universities about how to set that software up, because nobody offers that software, because nobody has the range of programs that we have. So there's software out now that will enroll you in Head Start and utility assistance, but it won't enroll you in Head Start, utility assistance, and our health centers. And to me, it does us very little good if we can't make sure you get to our health centers.
So some of that is like literally systems infrastructure, like just having a software program that will have that many avenues and threads that it can pursue.
Yes, and we've talked to universities about doing this, but that requires dollars beyond those that we have.
Yeah,
So
sounds expensive.
so for right now, we're co-locating staff.
Mm-hmm.
So we've got staff from several programs will occupy one building. So when somebody comes in to apply, they're able to access different programs in that one visit. I think the further down the road we go, the more use we can make of technology will help us link people to the services that they need.
Yeah. And so some of this is technology, some of this is infrastructure. Can you talk to us about how you see the best practice of, patient and provider, even if they are, co-located, is a fabulous accomplishment. How you see the usefulness of co-located care impacting the lives of rural Texans.
For the chronic problems that folks in our area have, and you're talking about hypertension and diabetes,
Mm-hmm.
literature will tell you that not only do you have some physical needs, but your well-being is impacted by those things. So the fact that we can get these guys into the community health center for what may be a primary health problem gives us an opportunity to get them over to an LPC. But it also gives us an opportunity to see what's going on in their lives. And so that if there's a way that we can maybe bring more resources to that family, if we can pay their light bill, if we can make sure that the food that they're buying with their food stamps, with their SNAP benefits, is something that's gonna support what they should be doing for meal prep. Those are the kinds of things that need to happen at that health center. When you say health center, I think folks traditionally think it's a doctor's visit.
Office, yeah.
It is not a doctor's visit. It is so beyond a doctor's visit. The rural communities carry challenges, but they also carry some benefits that larger communities don't have. So when our PAs are our doctors, our OB-GYNs, our dentists, our pediatricians see folks, they know who they are, they know how many people are in that family, they know what their family situation is, they've probably been seeing that family for a number of years.
Yeah.
So they're more intimately acquainted with that family than I think folks are in rural areas. I mean, in urban areas. So I think that, to me,
What a resource, right? Like that relationship, not just being something that makes you comfortable in disclosing to your doctor some of the things that, because that is a real phenomenon. People go to all sorts of doctors with ailments, intending to talk about them, and then they don't. For whatever reason, they don't. Right? But having that relationship and that rapport.
So one of the things I like to do when I'm at a health center is hang out in the exam room next to where the doctor is, because it's really important not only to see how the nurses treat the patients, but it's important to hear how the doctors are speaking to the patients. And I'm amazed at our doctors and the way that they talk to our patients and the things that they know about our patients and the advice that they will give our patients.
Yeah, and some of that is all that relationship also, can prompt adherence to, medication dosages and schedules and timing. Like
I don't want to let
through with referrals.
I don't want to let Dr. Kamat down.
Yeah.
So I'm going to be sure that she wants me to. I've actually heard patients tell me she wants me to lose 3 pounds by the next time I come back. Well, I don't want to let her down.
Yeah.
So I'm doing this.
Yeah.
So,
or they wanted me to follow up with this person and then tell them how the visit went next time I see them. I'm going to follow up with that referral. The value of the relationship is amazing.
The other thing about living in a small town is, like, you're in Dallas, you're working in a community health center, you go to the grocery store. I mean, these towns we live in have like one
One.
grocery store.
Yeah.
So the odds of running into one of our staff, one of our doctors, at the grocery store is like phenomenal.
Yeah.
So that doesn't happen in other places.
Yeah,
So
that's
that really does help build those relationships.
And that's a really good point to highlight, I think, is when your providers are in that space
Mhm.
where these folks live and love and pray and play, there is that contact. I don't know, there's something very humanistic about it. It's very human to see somebody, I think, and maybe this is what I'm getting to, is to see somebody not as a patient, but as a person,
Mhm.
too, who they're providing these services with. And I think that really is something about rural healthcare that maybe you don't always see in clinics, right? Because I think about my wife and, you know, the town she grew up in, like when she was living there was maybe 900 people, and yeah, everyone knew the dentist by the first name,
Mhm.
and you know, I mean, they had to drive to see them, but everybody knew the dentist to see him, and you know, everyone knew the pediatrician by their first name, and they went to church with them and things like that, and you know, she has these fond memories of her dentist, and I'm like, I don't remember my dentist
No,
growing up.
yeah.
Yeah, I lived in San Antonio.
Yeah.
I guess whenever insurance changed, it was a new dentist.
Yeah.
You know, if we had insurance that year. And so, you know, I think that relationship, again, back to this idea of there's this bonding, there's
Mhm.
this capital that y'all draw on as this amazing resource, and when it's present, a lot of special things can happen.
Well, I think it's very powerful. I think it's one reason, frankly, that the agency has been able to do what it's been able to do is because I really see the staff as a group
Mm-hmm.
having, propel this, this organization forward. And it's fun to see the young ones coming up now. So it's fun to see the folks that are in their 20s and 30s as they start out on this.
Yeah.
Because then, you think about what incredible challenges they're going to face, but also what incredible benefits that they're going to bring to the communities that we work in.
I hear you giving lots of very due credit, totally due credit to all the staff and the people, the 700 folks that work with you.
Yeah.
But I mean, I see it coming from you too. You're such a wonderful leader, and I can't help but to think that, your 40 plus years of being here with this group, that leadership, it's tough, I think, when you decide you're going to do a program to constantly go back and say, is this our values? Is this our mission? And having someone with that continuity of experience is just such a gift.
One thing about being here a while is that you have the advantage of hindsight.
Mm-hmm.
So, I can look back and see some places in the organization's development where, we, went to the left and we probably should have gone to the right.
Mm-hmm.
Or we stayed on course and it was probably time for a course correction. So I think it's important to be able to look back and really evaluate what you did. Not because to me, it's not just did we serve the 1,000 we said we were going to serve, but when we get money to do something, we serve that 1,000. But if we didn't leave anything else behind and we just did the service to the 1,000, we really didn't reach our full potential.
Mm-hmm.
So to me, it's leaving more than just that those service numbers behind.
Mm-hmm. Yeah. I heard someone say recently that her name's Fran Butterfloss, right? She's part of this like coalition, rural coalition movement, and really inspiring lady. And one of the things she was saying about differentiating between groups that have momentum and have sort of this virtue about what they're doing is that when it comes time to make a decision and no one knows what to do, they reference their values first and sort of say whether we're taking a right here or a left here or staying the course, is what we're doing true to what we want to stand for? And I'm not sure that everybody in every area and every agency always does that because there is such, I guess, you do have minimums and you do have outcomes and you do need to make sure that programs can be renewed because a lot of, when I hear nonprofit, one of the things like the instant comes like soft money, and to keep, things afloat and resources available, there is an element of it that is outcome driven and minimum driven and things like that. But it seems like y'all have been able to stay so true to what you stand for all these years.
I don't know if you've ever been to our kitchen in Falfurrias, but the place where we prepare the meals for the seniors and the Head Start program, so the cinder block building.
Mm-hmm.
So I knew we were kind of on the right track probably 5 years ago when I went to visit the folks at the kitchen and opened the door, and in the door that leads into the prep room, the cooks had made a copy of our mission and had put it on the door, and no one told them to do that.
Yeah.
This was just something that they've got on the door, so when they're going to the kitchen every morning, there's our mission. And I think that's important. I think that the mission needs to be out there. It's at the top of every board agenda that we have, and our vision and mission and values are hanging prominently in most of the offices that we have. But that wasn't written in an office. The vision and the mission and the values came from staff.
Yeah.
So we had all the staff participating in that. So it's, to me, that's important. It wasn't just, here this is, read it, what do you think?
We've checked off that you've read the mission.
Yeah. Sign it.
We'll
Here
never
we go.
ask you about it again. So I think we've very much highlighted how important contact and relationships are in being successful in rural care. And then there's this other aspect of how do we organize it, right? Like, how do we organize the systems? And it sounds like y'all had to be really flexible and responsive in that too. Whereas, in a place like Falfurrias, you have your health center there, and you've got basically within like half a mile, you've got a ton of services right there, from Head Start to a senior center to medical care. You name it, they're all there. But then y'all also have places like, is it in Mathis, where connected with the school, you'll have a health center?
Yes.
With professional counselors and case management and medical providers, and I think I heard that y'all have worked out a situation with the school where they put in like crosswalks or something, and there's an MOU that was or an MOA that was established for like the school counselor to be able to walk students over to.
Exactly.
So that while they're at school, they're in this catchment area of service potential. They're able to see a doctor, they're able to see a professional counselor, they're able to see a case manager, and then go back to the learning environment.
Exactly.
And
so let's talk about Mathis a minute, because I'm really, the PA that we have out there, Marie Hall, is really involved with her patients. So there was a student that showed up one day that the nurse from the school had walked over. Student wasn't feeling well, and took her to the health center, and Marie knew right away that something was up besides an illness. It was more than just a bug, and started talking to the child, and it turns out that the child was homeless. The child's family was homeless, and they were living in had been living in an automobile. They'd been living in a car for a couple of weeks. So Marie made arrangements to pay for the child's family to move into a motel, and got the family moved into a motel. And then Marie called our office to find out what all we could do for this family. And our community services guys, kicked it into high gear, and they were able to provide some supports for this family so that they could have a stable home, and then we could get the families hooked up with as many systems of support and social services as we could. That stuff doesn't happen unless our providers and anyone that comes across somebody that we serve isn't thinking of the global need
Mm-hmm.
of that family.
Yeah.
So I think that's real important. It's not just that, you know, we're working on this, you know, 5-year project of trying to find an integrated application system, but it's that our service providers have to have that global understanding
Mm-hmm.
that family may be there for one thing, but there are other needs in that family.
Yeah.
And how do we marshal those resources? What's the quickest way we can do that? If you look at school beyond just school,
Yeah.
and you look at going to the doctor beyond just going to the doctor, it may be that singular act, but if you can help folks organize their life around some sort of universal understandings of what improves the way folks live,
Mm-hmm.
to me, those are the points at which you capture them.
Yeah.
But it's up to us. I mean, our charge, you know, I know when the feds look at us, our charge is to serve 1,300 kids in Head Start and early Head Start.
Mm-hmm.
So we will do that, but it's the way in which we do it
Yeah.
that I think makes us special, and that I think makes us have the opportunity to impact people's lives in some very positive ways. I get really excited, right? We've got a speech therapist that's working for us at ECI in Corpus Christi
Mhm.
right now. He was a Head Start kid.
Mm-hmm.
I didn't know
Wow.
it. I didn't know it, and had gone over there to meet the new staff, and I was giving them the spiel about, oh, here's what all we do, you know,
Mhm.
here's what all community action does.
It's like, I
And
know.
this young man raises his hand and
Yeah.
goes, I know, I was a Head Start kid.
Yeah.
You know, I went to school in the Kingsville Head Start Center.
Mm-hmm.
So those are the kinds of things that to me are really cool.
Yeah.
You know, you know you're impacting lives. Years ago, we started a voluntary program, and we do a variety of things throughout the year, and we give scholarships to the children or grandchildren of employees.
Mm-hmm.
One of the things that I really encourage staff to do, and hooray, they do it, you know, that's wonderful, is look at different models.
Mhm.
See what models are out there, see what's working. Because if we're doing the same thing that we were doing the year before,
Mm-hmm.
we're not doing our job.
Mm-hmm.
We need every year to be moving, every year we need to be adding something, every year we need to be doing something better.
Yeah.
If we're doing something 2 years in a row and we haven't added something,
Mm-hmm.
we're shortchanging the communities that we're in.
Yeah. You know, that continuous quality improvement is so important, because a lot of times you will see a program that has been around for 10 years and it hasn't changed. And it's hard to imagine, especially, you know, and this is probably the child and adolescent counselor advocating maybe, but kids today are not the same as kids 10 years
Mhm.
ago, 20 years ago. And so when you see programs that have remained unchanged, you know, you mentioned evidence-based treatment models, and you know, in counseling we have a lot of counseling curricula, these
Mhm.
manuals, and you look at the copyright on some, it's like 1993, 1998. I graduated high school in 1998. I didn't own a cell phone, like, so just in that like one thing that kind of radiates outward, me and my friends were so different
Mhm.
than high school seniors this year because of connectivity and, you know, access to information and things like this. So hearing y'all talk about that continuous quality improvement kind of spirit is so refreshing.
It's really, I mean, anyone that does this work, I would really advise that they get as diverse of a workforce as they can.
Mm-hmm.
So it's gotta be multi-generational,
Mm-hmm.
and, you know, it has to be gender diverse.
Mm-hmm.
Women need a place at the decision-making table. That's something I'm, you know, pretty passionate about. I like the fact that we have a pretty wide mix of ethnic groups here.
Mm-hmm.
But it's fun to see the way that the workforce interacts
Mm-hmm.
with each other. It's changed quite a bit since when I first started,
Mm-hmm.
and that's fun to see.
Yeah. Well, and you know, but it probably makes for some very interesting and exciting meetings and discussions and things like that. But I think when people have that good heart about it, that good spirit about it, you know, all those differences are viewed as strengths,
Mhm.
not barriers.
I like to watch, and I think this is real important for everything actually, is everybody who participates in the work that we do contributes in a way that's valued. So folks' contribution has to be valued and it has to be respected. And that's sort of, regardless of where they are in the hierarchy. The hierarchy can't drive the organization. The organization is driven by the mission.
Yeah.
The hierarchy sometimes doesn't even get to steer the wheel. So to me, that's the opinions of the cooks in Foul Furious are very important about what we do. After all, they know more about what they're doing than I do, frankly. So I think that's really important.
Awesome. So just to draw on one last piece of wisdom for you before we close up here, looking forward, what do you think is going to be important for folks who are working with rural populations, working in rural communities, working with rural communities, to be mindful of or to be vigilant in doing if we are going to be able to make the impact that we're capable of and that people deserve,
We need to attract more professionals to our service areas. And to do that, our service areas have to be places where professionals want to locate. So it's incumbent upon all of us to make sure that our school districts and our counties and our cities are functioning at a level that doctors will move into. And I'm just using doctors as an example. But you have to have strong community institutions. Whether you're rural or you're urban, those community institutions have got to be strong in order to attract professionals. That is incumbent upon us as staff people to do what we can to make sure that we are responsible citizens in the spaces that we occupy. The next thing that I think we have to figure out is different ways to deliver the service that we're delivering. And I think technology will play a huge role in that. The other challenge I think we're gonna have shortly is climate change and what that's gonna do to the systems that we've already established. How is that gonna disrupt service delivery, and how can we deliver service when we have climate extremes? That to me I think is gonna be important. The other thing I would hope that we can do is work together in deeper ways than we have in the past with our public school systems, to make sure that we do everything we can do to support young children and their families, because I really think that is going to be critical in the next 10, 15 years for this area.
Yeah. Excellent. Well, thank you so much for talking with me, with us about all this. Again, we just really admire what y'all are doing and find ourselves so grateful for not just you, but the other 700 people who aren't here, who are out there making